So, good morning, all. This is Dr. Punis Samaya, Assistant Professor, Department of Pharmacy, Shri GS Institute of Technology and Science, Indore. And my second topic core video is on Angina Pectoris, and I am submitting this PPT to 6th Faculty Induction Program, which is organized by HRDC TVV Indore. So, let's start. So, what is angina pectoris? So, angina pectoris is a pain syndrome, and this pain syndrome occurs as when there is a oxygen demand situation in the myocardium, and that oxygen demand is not going to be met because of some ischemic condition or some blockage. So that part of the heart will not function properly, and it will reflect in the form of angina pectoris. So basically angina pectoris is classified into two forms. First is the classical angina, and which is the most common form, and the other is the variant or princemetal or vasospastic angina, which is the uncommon form. So it is the commonest form. Classical angina is the commonest form. So what happens in this? So in this, the attacks are predictably provoked by exercise. So here there is a stable blockage in the one of the three coronary arteries or all the three coronary arteries of the heart. So there is a stable plaque. So due to that plaque, what happens when we perform exercise, or we are in an emotional state, or we are eating, or in a quietus condition? In all these conditions, there is a increase in the demand of oxygen, but due to that blockage, that permanent blockage, that oxygen demand and the supply of the blood to that area is not proper. So as a result, the classical angina attack takes place. And same, I told you that the atherosclerosis, fixed atherosclerosis or ischemia is the main cause of this classical angina. And then we come to the variant angina, which is uncommon form, means it is not a common, it not occurs generally. So in these cases, the attack occurs at rest condition, when you are resting or during the sleep, and they are unpredictable. You cannot predict them, and they are due to recurring localization of coronary vasospasm. Okay, so here in the diagram you can see that here the three conditions are given in this, are shown in this diagram. That is, first one is the normal condition, second one is the classical angina condition, and third is the variant angina condition. So in the first one, we can see that there is no blockage in the coronary artery, and there are two types of vessels present: conducting vessel and resistance vessel. Okay, so in conducting vessel, you can see at the condition of rest, the size of the lumen is normal, and in exercise condition, when there is a increased demand of the oxygen and blood, then the size of the lumen slightly increases during exercise, and the same condition is with the resistance vessel also. But in the classical angina, as we can see, there is a plaque formation which is known as atheroma. So here what happens when there is an increased demand of blood and oxygen, that due to that hardening and the presence of atheroma, the size of the lumen of the coronary artery does not increases, so the whatever oxygen demand is required, it is not fulfilled. And the same condition is with the resistant vessel. There is a very little increase in the diameter, so from here also the demand is not met. In variant angina, as we can see, at the rest condition, the lumen size is as normal as not as in the means it is equal to the normal condition, but sudden vasospasm takes place, which it causes or leads to the narrowing of the lumen of the coronary arteries, and due to which the flow decreases or the oxygen demand or blood supply decreases, and it leads to pain. Then the classification of the drugs which are used to relieve angina pectoris. Various classes are nitrates, beta blockers, calcium channel blockers, potassium channel openers, and others. So nitrates, in this nitrates, two types of nitrates are used: short acting and long acting. Short acting nitrates, they work promptly and they are short acting. So examples are glyceryl trinitrate, which is known as GTN, and nitroglycerin. And in long acting it is isosorbide dinitrate, then isosorbide mononitrate, and so on. And also beta blockers are used to decrease the functioning or working of the heart to give a relax at this condition. So propranolol, metoprolol, atenolol, and other drugs of beta blockers category are used. And calcium channel blockers are also often used, like phenylethylamine, verapamil, that diltiazem, nifedipine, and so on. Potassium channel openers are also used, but very on the very little basis. Example is nicorandil, and in others dipyridamole, trimetazine, and so on, the drugs are used. Okay, so now I will discuss here the mechanism of action of the glyceryl trinitrates, which is a nitrodilator, that how it relieves in angina if we take this drug. So what happens, this is the example of the smooth muscle of the coronary artery. Okay, so what happens inside this, as we can see, the calcium channels are present on the membrane of these muscles, through which the calcium enters, the intracellular calcium enters the cell, and this calcium along with cam means colmodulin, it reacts, and what it does, a protein is present in this which is known as MLCK, which is myosin light chain kinase, and this myosin light chain kinase phosphorylation takes place and it is activated, and what it does, it catalyzes the myosin phosphorylation, which slides on the acting, and contraction takes place, due to which the vasospasm is taken in and the pain symptom is coming. So we want to relax this condition, means we do not want the contraction. So in this condition, what the nitric oxide does, the nitric oxide, there is a secondary messenger called GTP, guanosine triphosphate, which is converted to cyclic guanosine monophosphate, and this guanosine monophosphate performs two functions. Firstly, it blocks the calcium channels, voltage gated calcium channels, which are present on the membrane of the smooth muscles of the coronary arteries, and also it inhibits the phosphorylation of MLCK. So as a condition, the relaxation takes place. And these are the table of various organic nitrates which are available in the market for treatment of angina pectoris, like GT and glyceryl trinitrate, which is very common, known as nitroglycerin. It comes under that trade names like Angiside 0.5 mg, nitrolingual, then Angispasm, Span, Nitro, Contin, Nitroderm, and so on. And others like isosorbide dinitrate is there, in the form sorbinitrate, which comes in the doses of 5 and 10 milligram tablet, and the duration is 20 to 40 minutes for this, and for nitroglycerin it is 10 to 30 minutes. Then isosorbide 5 mononitrate, it acts for 6 to 10 hours, and the pentaerythrotriol tetranitrate acts for 8 to 12 hours. So uses of these nitrates are in angina pectoris, then acute coronary syndromes, myocardial infarctions, congestive heart failure, and left ventricular failure, esophageal spasm, cyanide poisoning, and all those things. For this they are used. So thank you so much for being with me to listen this video. Thank you so much.